My name is Dr. Ary Krau. I'm a board-certified plastic surgeon. I've been in practice now for more than 20 years. I operate both in my private office in Bay Harbor Islands as well as here at CG Cosmetic Center, which is probably the busiest center in the country. We perform probably more surgeries here than any other center in the 50 states. But today I'd like to talk about rhinoplasty, one of my favorite operations. I like it basically because it's detail-oriented and little millimeters of changes can go a long way. Sometimes less is more, and all the different parts of the nose have to work together, and in order to do it well, you have to know how changes in one part of the nose can affect another part of the nose. There are several reasons why patients may come to us for rhinoplasty, and today at least we're going to focus on the cosmetic aspect. The functional aspect of breathing obviously is very important, and we respect that. It's not worth creating a beautiful nose if the patient can't breathe afterwards. So obviously we pay as much attention to the functional aspect of the nose as we do to the outside of the nose, or the cosmetic aspect of the nose. And there's a variety of reasons why patients come to us regarding changing the shape of the nose, whether it be the tip is a little bit too wide, too bulbous as we say, or when they smile the tip kind of comes down, or in profile view. A lot of patients just can't stand seeing themselves in the mirror walking down the street, or in a window, or perhaps in a dressing room where you could get a 270-degree view of yourself, and sometimes the side view can be quite disturbing. Anyway, as far as how we do surgery and how we address these, generally there are two ways to do rhinoplasty. One is an endonasal or closed approach, the other one is an open approach. And the difference is technically for the patients to know is that there's one additional incision when we do an open approach. A closed approach, all the incisions are done within the nostrils, so you can't see any incisions. On an open approach, you still have those incisions pretty much, but you have one that connects the two nostrils, and that's right here at the thinnest part that divides the nostrils. We call that the columella. In the open approach, we can actually see the anatomy of the nose much more than we can in a closed approach. But we don't always have to see the whole anatomy. The decision to either do a closed approach or an open approach has to do with what we have to do to the nose and the comfort level of the surgeon. I generally prefer to do closed approaches for the majority of noses, unless of course we have to do something to the actual tip of the nose. And the tip is that point of the nose that is right in the center of the lower part of the nose, that when you look on profile, the part that projects out the most. That's basically the tip. I'm not talking about the area above it, which we call the super tip. That we can reach with a closed approach. But if one has to do changes to the actual tip of the nose, then one is better off to do this thing open. And that basically is, as a general rule, divides what we're going to do with each particular patient. The simple complaint that we generally treat is just a large hump. And that's what we call the dorsum of the nose. And the dorsum is defined by the area that's the upper third and the middle third. And the upper third is bony, and the middle third is cartilaginous. So when we take the hump down, we basically have to take the bony hump down, and then we have to take the cartilaginous hump down. The way we do that is basically we just, as far as the bone goes, we just kind of file it down. And sometimes if it's too wide, we have to bring the bones closer together. Regarding the middle third of the nose, which is made up of the two side walls and the middle part, which is the septum, obviously those things have to be trimmed down for them to come down to meet the rest of the bridge. And a lot of times, we also have to work on the tip. Although someone may come in complaining of the dorsum for the most part and doesn't pay too much attention to the tip, a lot of times when we take the dorsum down, then the tip becomes uncovered, and it looks now a bit big. So you always have to treat the nose in its entirety. You generally can't just operate on different parts of the nose, because one, like I said before, one part is correlated with the other part, and when we take one part down, the other one may look exaggerated. So let's talk a little bit about the anatomy of the nose. The nose itself actually has three layers. So we have the skin that we visualize, we have the middle layer, which is made up of bone in the upper third and cartilage in the lower 2/3, and then the inside is the lining of the nose, or what we call the mucosa. When we operate on the nose, we generally do not touch the skin, and we generally do not touch the mucosal lining, and we operate on the middle layer. And that's the bone on top and the cartilage in the bottom, middle third and the lower third. And when patients come in for particular complaints, whether they have a bump on their bridge or the tip is too big, we basically make access to that middle layer, and we address the anatomy there. And the skin usually just comes and meets those the new architecture that we produce from surgery. So how do you choose a surgeon to perform a rhinoplasty? Basically, once you go to a board-certified surgeon, and there are basically two disciplines that treat noses. It's either plastic surgeons or ear, nose, and throat doctors. Traditionally speaking, plastic surgeons dealt more with the cosmetic aspect, and the ENT dealt more with the functional. Those two disciplines are not they met somewhere in the middle, where plastic surgeons do both the cosmetic aspect as well as the functional, and the ear, nose, and throat doctors do the same. As far as which discipline to choose, obviously I'm biased, so I would prefer to go see a plastic surgeon, but it really is based on the individual. If the individual surgeon has a particular passion to perform rhinoplasty, that's the one you should find to perform your rhinoplasty. And how to choose a surgeon, it's just the basic ways we choose plastic surgeons for any procedure. Obviously, they should be board certified, they should have a good reputation, and their reviews are critical, and their befores and afters are critical. So I'm biased, I like to do rhinoplasty, so it is one of my passions. We do a lot of rhinoplasties here, both at the center, Coral Gables Cosmetic Center, as well as in my private office. So if you're interested in rhinoplasty, give us a call. We'd be glad to see you for a consultation, and we'll take it from there. Thank you.